Hello, this is Dr. Gay from First Look MRI, and this is a 52-year-old male who was trying to start his lawnmower and felt pain and a pop in his hand. They did x-rays and they saw a fracture of the distal phalanx of the ring finger. Here it is. You can see it on plain x-rays nicely, and they suspected also a tear of a tendon, and so they did an MRI of the hand here to see, and we do see that there is a problem. We have the flexor tendons of the ring finger here together. We see the superficialis over the top, profundus deep here. As we follow them up, the superficialis is going to end right here, and it's going to split open, and then the profundus is going to come through it and keep on going all the way over here to the distal phalanx. So we see absence of the profundus from here all the way to here. So it looks like it's torn from the distal insertion and retracted back to here. And so where's the rest of it? Then if it's retracted back here, and if we look in the palm, we see that there is some redundancy of the profundus right here. So it looks like it is retracted backwards. Everything is pretty straight through here, and right here it gets wavy. So we'll see that better in another sequence. This is a coronal T2 fat sat sequence. And this one we can see that they have marrow edema in the distal phalanx here, and we see this tendon comes up, makes a little loop up on itself, and it keeps on going up. So abnormal signal throughout this tendon in the distal palm. And the question is it partially torn here too, or is all this abnormal signal just from the redundancy and recoiling? And sometimes it can be pretty difficult, as in this case. And of course, you can always hedge, as you say, this is redundant with an abnormal contour and fluid in the tendon sheath. Superimposed partial tear can't be excluded. Now in axial images, we see the flexor tendons here in the palm. If we go distal, we start to see the partially torn flexor digitorum profundus here, the fourth right there. Here's the superficialis next to it looking normal. And really, if you just had this view, you'd say, well, that is definitely torn. Look at that. It's thick, increased signal, so there may be a partial tear. And also the redundancy may add to the why it looks so funny here. But it can be faked out a lot by the tortuosity and redundancy. So that may not even be a tear, even though it looks exactly like one. Now following that out distally, we're going to go into the ring finger here. Now these look pretty good here. And we're going to follow this out. Now we're at the proximal phalanx, looking decent. Going out to the PIP joint. And then at the PIP joint here, we start to lose it. We see the superficialis splitting here into these two components. And the profundus should come right there, right in between, like on this side. And it should go here distally, but on this view, this is the smoking gun. We see a fluid-filled gap right here where the tendon should be. So again, a ruptured flexor digitorum profundus tendon, and it's recoiled down here in the distal palm and probably partially torn there as well. And that's it. Thank you very much.